year, the WHO Southeast Asia region launches a series of publications during the Regional Committee session. This year, the following publications are being launched in the virtual session. Progress towards malaria-free. WHO Southeast Asia describes the progress in the region towards malaria elimination since 2010 and the different milestones, goals and challenges that exist in each member country. This publication captures Myanmar's efforts for elimination of trachoma, a disease that can lead to blindness if not treated at an early stage, and which was endemic among 6.2 million people in Myanmar. A first-of-its-kind publication in the region, this covers the pictorial identification of 76 species of vectors transmitting diseases in WHO Southeast Asia region. This is a user-friendly guide for public health workers, school teachers, students, researchers, and other interested groups. The Leprosy e-learning package is a set of web-based self-learning modules targeted for healthcare workers, doctors, physiotherapists and others. The topics include diagnosis and treatment of leprosy, counseling of patients, managing reactions to treatment, and management of disabilities. Celebrate Life is a tribute to health workers delivering immunization and other essential health services during the ongoing COVID-19 pandemic. Those profiled in this publication represent the unwavering commitment of health workers across WHO Southeast Asia region. Analysis of 3 rounds of tripartite AMR country self-assessment surveys in the region from 2016 to 2019 is in line with the World Health Assembly resolution for strengthening monitoring for antimicrobial resistance. We are the only WHO region with 100% participation in this survey for 4 consecutive years. This evaluation documents the progress at the regional and country level in each of the 8 flagships, including achievements and success stories, best practices, and key challenges encountered between 2014 to 2018. The regional strategic framework is focused on achieving 4 outcomes: delivery of high-impact interventions in prioritized areas, health system interventions, community mobilization for improved sexual and reproductive health rights, and fostering collaboration between member states for accelerating progress through learning from best practices and innovations. The report highlights the progress made in the region towards universal health coverage and health-related SDG targets. This year's report also includes a summary of the progress using country-comparable estimates. This mid-term review assesses the health workforce situation and the progress made so far by member countries at the halfway mark of the decade. It assesses progress on health workforce governance, transformative education, rural retention, data, health workforce and COVID-19, and progress made in the year of the nurse and the midwife. This publication analyzes the progress made on improving rural retention of health workers in the region and identifies some good practices from Bhutan, Indonesia, Myanmar, Sri Lanka, Thailand, and India. The report explains how coordinated efforts have led to the implementation of evidence-based policies by countries, thus improving the availability and distribution of health workers in rural areas. With non-communicable diseases posing a serious threat in the region and accounting for nearly 2/3 of all deaths, this report summarizes prevention and control measures for NCDs. The report highlights achievements as well as gaps that need to be addressed to prevent and control non-communicable diseases. This publication draws focus on a coordinated and multi-sectoral approach at all levels of health system to reduce the incidence of diabetes and the onset of diabetic retinopathy. Diabetic retinopathy is preventable, periodic eye examinations by ophthalmologists accompanied by standard treatment of diabetic retinopathy can postpone serious loss of vision. The first edition of the Tobacco Atlas, Perspectives from the Southeast Asia region, attempts to project the present burden of tobacco use, progress made in the implementation of policies and the laws for prevention and control of tobacco. It also identifies challenges and suggests the way forward. This document chronicles the change brought about by COVID-19, from epidemiology and laboratory surveillance to clinical management and risk communication, from partnership to logistics. This book identifies the shifts that have occurred and why. This publication is also a tribute to the strength and resilience of frontline workers and people of the region.